Well, welcome to the interview. My name is Judy Dukeshire, and I'm the Director of Nursing the Future. I have the pleasure of having with me today Darla Allen. Darla is a registered nurse and identifies with the Inuvialuit peoples who live and work in the Western Canadian Arctic region. A recent graduate, 2023, from the University of Victoria through Aurora College in Yellowknife, Darla works on the pediatrics unit at Stanton Territorial Hospital in Yellowknife, the Northwest Territories. Darla started her nursing career by being part of the Canadian Association of Schools of Nursing Residency Program, which assisted her to find her footing in the early stages of her career. Darla is proud to be able to use her culture to provide comfort and support to her patients and their families. Welcome, Darla.
Thank you.
How are you doing today?
I'm good. How are you?
I'm great. Thank you so much for asking. So, well, let's dig in. Let's talk about, before we got started, you told me that you actually started practicing, you experienced your transition during the fires in the Northwest Territories last year where you had to evacuate. My goodness, was that like?
It was interesting. Yeah, it was about a month after I started nursing. Very interesting to the start of my nursing career. We had to kind of evacuate on short notice and get all the patients out of the hospital as well. So just making sure that the patients had everything to go. They were going from like to Edmonton, Calgary, places in BC. It was crazy just making sure that everyone knew where everyone was going and had all their belongings. It was definitely interesting and a little scary getting out of there ourselves after all the patients had gone. But yeah, I'm glad our community is okay and that we're all safe.
We're glad too. My goodness, in Kamloops and in sort of the interior of BC, we are dealing with fires all the time, and it's a very frightening experience. So I'm so glad that you came out of it relatively unscathed, as did a lot of your patients and families. That's fairly good news. So, Darla, that must have been a very challenging experience to have when you're also trying to transition into your new nursing profession. What do you think having that fire as a part of your experience did to your transition experience?
Yeah, it definitely made the transition process interesting. Having to leave kind of on short notice and make sure all of our patients were out of the hospital, going to various different cities and communities was interesting and hard work, making sure everyone had their belongings and their family members knew where they were going and whatnot. And also just like us getting out, like kind of the last people to get out was scary. It was interesting with our transition period, being like for our orientations. I was in a hotel room, like doing these orientations over a computer with like all my classmates while like my territory is on fire. So that was kind of like, it was kind of hard to focus at times, but I'm glad that I like had the support of my classmates as well. And we all made it home safe, which I'm happy, and our community is safe and we're all doing okay over here right now.
Yeah, that would be an interesting stress added on to the stress of making a transition to practice. And what I find interesting is you somehow found a way to navigate all of that. I mean, doing your orientation in a hotel room, and wow, I take my hat off to you in how you coped with that whole situation. So well done,
Well,
Darla.
thank you. It was
And there
definitely
you are,
like
you're still
scary.
there.
Oh yeah. It was definitely scary, like not knowing if I'll be like I was missing practice time and like knowing if I would be like okay, if it was gonna affect me in any way. I'm fine. Like it didn't, I still learned everything I needed to learn. So I'm happy about that. But in the moment I was like, I hope this doesn't affect how I am as a nurse kind of thing. But yeah, I'm happy I'm okay and our community is okay as well.
Absolutely. Now, is this the place that you had intended to enter practice? Like, how did you come to enter practice at Stanton Hospital?
Um, well, through the CASN or the staff education department, they kind of emailed us like, where are your interests? My interests were initially like surgery or medicine. However, with like there's kind of what's kind of like a lull in mentors. So I was offered to go to pediatrics with a mentor, Megan Rondelet, who's amazing. And I was like, okay, I'll have a good mentor. Like I can do this. So I decided to go there, and I'm so happy I did. It's like probably the best decision I've made so far. I love pediatrics.
Well, isn't that an incredible turn of events, right? You didn't plan that. So there's something to be said there, isn't there? That a graduate might have an intent and they might have a path, but life might take them on a different path that is as good, if not better, is what you're saying.
Yeah, definitely everything happens for a reason, which thankful for.
Hmm. Well, maybe tell me a little bit about what that transition experience was like, and what it was like to be in the CASN program.
Yeah. Um, I think it was a great transition. I had like a great time. I felt well supported in the CASN program. So I had a mentor. I had two different mentors, just because like staffing stuff, within the 3 months. And I've never felt so supported or like listened to in my life. Like I just felt like I could feel my confidence growing day day by day. It was harder some days, of course, but um just having like someone beside me in the initial stages of nursing was amazing and so helpful for me. And just someone to be there and like instantly give me feedback if I need it, kind of thing. Um, yeah, I think I would prefer that. Like I was so scared of going into nursing and being thrown in the deep end, which I feel like we hear so much, and it was just such a pleasant experience for me, I think.
Well, let's just remind the viewers, because they may not know that CASN has a residency program, and so they can go to the Canadian Association of Schools of Nursing website and find out more about it. But you were essentially given this mentor, Megan,
Mhm.
for the 6 months from
Yeah.
start to up to the end of 6 months. And the first 3 months, you worked one-on-one
Yes.
and you shared a workload. And then the second 3 months, Megan was available to you, but you had your own workload. Is that accurate?
Yeah, so between my two preceptors, my second preceptor was, yes, so she ended me off on of my 3 months, and then she was there with me um for the remaining 3 months, and just as like a support system. And well, the whole unit was a support system, but just having that one individual who has seen me since like the beginning to be my support system as well. Um, yeah, it really allowed me to like grow at a pace I needed to grow. That was very beneficial for me. Yeah.
Yeah, it sounds like it was very supportive. It sounds like the whole unit kind of rallied around you.
Yeah.
Well, that's always nice. What do you think, even with that kind of support, what do you think was the most challenging part of transitioning from being a student to being a graduate?
Um, I would say the most challenging part of transitioning from student to graduate would have to be the way it affected my confidence. Um, Imposter syndrome is so very real. Um, I kind of coped through this through like talking with my friends who were also in the new grad program, mainly to make sure I wasn't the only one feeling that way, which I wasn't. Um, and just like getting feedback from and talking to, crying to probably my mentor, the clinical coordinator, and other nurses on the unit. Yeah, my confidence was definitely a challenge in the beginning. Just being like, I'm meant to be here. Like I am here kind of thing, and you can do it kind of thing was important for me to remember at the time.
Absolutely. What do you think enhanced your confidence over time? Was there anything in particular, or did it just gradually start to increase?
It definitely like gradually increased, but I think just having um the support from my mentors and like having them tell me that I'm doing a good job was really important for me. And just like letting me ask like not dumb questions, but silly questions that I definitely knew the answer to, but just needed to be reminded. I think that was definitely what kind of like got me through until my confidence is where it's at now. I'm definitely not fully confident, but um, it definitely helped me get to where I am now, which I'm so grateful for.
Well, it takes a long time to get your confidence
Mm.
up. And there are moments, well, even in my career, where you're kind of confident and then something new comes along and it just sort of undermines that confidence and shakes it up for a while. And then you gain even more confidence from that experience. So I think that that's just going to be a bit of ebb and flow for you.
Yes, definitely.
Yeah, absolutely. Was it what you expected that it was going to be, the transition?
Um, it definitely wasn't what I was expecting, what I thought it would be. It was harder than I thought it would be. I think you have this picture in your head of like, okay, I'm gonna graduate, I'm gonna be a nurse, I'm gonna be a rock star, like, and then I'll be good forever, kind of thing. And that's really not the case. I think it's like hard also when you start and you see these nurses who like came before you and you're like, this is the smartest, most confident person I know. Like, why, how do you not have the same thoughts I do? Like, kind of thing. Then again, like I don't know about others. It's so easy for me to be like hard on myself. Um, and I want to be like good immediately. So that was definitely something that made it like not what I was expecting. Of course it's not I'm trying to find the word. It's not realistic to be good at anything right at you as you start. But like being where I am now, I know that these nurses, like although they are still like the most intelligent people I know, they don't know everything. And I think it's important to know like that we all came from the same spot in the beginning of nursing and we all have our own ways of doing things and I don't yeah,
No,
they're the smartest people I know, and they still like ask questions and bounce ideas off each other. And they're a lot more like me than I thought they were in the beginning.
well, exactly, right? And you can't be expected to know everything when you come into practice. And it took them years and probably a lot of mistakes. Thinking of my own experience, probably a lot of mistakes and sort of spending time thinking about, okay, what happened there and why did it happen? And then the next time it's a little bit different. So,
Yeah,
but
exactly.
you're absolutely right on track with everybody else when you say that it's not what I expected. And I think it's an important piece for new graduates to have that sense of confidence when they go in, because they're actually underneath pretty terrified. Uh, but they emit this aura of confidence, because if you didn't feel that or have that inside, even if you don't necessarily believe it, if you didn't have it, you would have a hard time going into work, I would imagine.
Yeah, definitely.
Yeah. How do you feel your schooling prepared you to take on the professional nursing role?
I think it helped me like very well. We learned a lot about professionalism. I definitely, again, like it wasn't what I was expecting. Um, it was like knowing now, like I didn't know before. The amount of decisions we make all the time, that was kind of like a shock to me. Like people are constantly like looking for an answer from me. I need to make a decision on X, Y, Z. What's the best one? You touch on it in school and whatever, but the reality of it is so much more intense, I guess. Like just the amount of decisions you make throughout a 12-hour shift is a lot. And like you're in charge of like your patients and you're conveying with the team and it's so much more than I thought it was. Like I always knew that you did these things, but being in the mix of it, it's definitely so different.
Well, it is because when you're in school and you're working with your faculty in the clinical area, you might be making a lot of decisions, but you don't know that you're making them, because you're making
Yeah.
them in collaboration with your
Yes,
faculty person. And then all of a sudden it's just you. And so the weight of those decisions is much different. Would you agree?
I definitely agree. It's definitely like you feel like you have a lot on your shoulders. Then you look around and you realize like, oh, I have all these people here that can help me. And yeah,
Well, that's good. I mean, I'm glad you felt that. And I think that's one real advantage of the CASN residency program is that you do have that cushion of support for what are the most difficult months. And those are the initial 6 months of practice. So I'm glad that you had that support and that you felt so embraced by your colleagues. Is there anything in particular that you would have liked to know before you graduated that you didn't?
um, that's a good question. I of course I would want to know everything that I was getting into. But I don't know. I feel like I knew what I knew when I was going in, and from there I've just been learning. And I think I don't know. That's a really good question.
Well, it sounds like you feel as though you had the content that you needed to make the decisions and whatnot. It's the sense of responsibility and that the weight of the decisions, that's not necessarily even something you can teach someone. It's something that they have to experience.
Definitely.
Mm-hmm. So now I understand that you did your undergrad education in the Northwest Territories. So do you think your familiarity with the hospital helped you with your transition?
Definitely. I think it not only helped me with like familiarity with where things are and like where to go for this, where to go for this, but also kind of like knowing who like the interdisciplinary team is, knowing who the doctors are, knowing like what the unit clerk does here, like the process of getting labs down to lab or whatever, like so many things. I think it definitely was kind of just like one less thing I had to worry about when I got there. I see like some locums, they're like, what, how do I do this? Like, where do I go for this? And it's like, oh, like I'm grateful that I learned that like in second year of nursing school kind of thing. Yeah.
Yeah, absolutely. It's important to be familiar, to have consistency and stability, and to recognize things is really wonderful so that all those other pieces of the application of the theory, you can focus on that because you know where to get things, you know the people. So I'm glad that you had that familiarity before you went in.
Yeah.
So I want to just talk a little bit about practicing in an Indigenous population, because there's a certain assumption, I think, when working in Indigenous populations that it's critical to ensure that there is a strong, seamless relationship between Indigenous culture and Indigenous care. And you are identifying as an Indigenous individual. So how do you think your heritage prepared you to incorporate Indigenous culture and social norms into your new practice?
Um, I think being Indigenous kind of has allowed me to care from like a place within. I often think of like my ancestors and my family when caring for Indigenous patients. Like, I want to care for them like how I would want my ancestors or like my family members to be cared for, which is the same with any patient, not just Indigenous patients. But there's just like a special piece of my heart when it comes to like Indigenous patients for sure. Um, I want to make sure that they're listened to, not only heard, but listened to. I want them to feel as comfortable as possible and safe when I'm around or when they're in the hospital. Um, I think it's important to like advocate for patients who might not agree with their plan of care or want to change something in their plan of care that is kind of more culturally, they want to add some like cultural aspects into their plan of care. So advocating for patients for that, I think, is really important for me, just because it makes them feel more safe, I think. So I think that's really important. I also to make sure my patients and their family members are well educated on what's going on while their family members in the hospital or while they're in the hospital. I think oftentimes there's so much medical jargon and not everyone understands that. So I think if I can't explain something, like having the doctor re-explain it kind of thing, or just making sure these patients are aware of everything that's going on while in the hospital, and making sure that they're safe and comfortable.
Absolutely. And though a lot of, as you said, a lot of those ideas apply whether that individual is Indigenous or not. But when it comes to individuals who are Indigenous and may feel a greater sense of vulnerability, excuse me, in the healthcare system, what is it that you would want to say to settlers who are nurses, to non-Indigenous individuals, new graduates, for instance, wanting to come to a community such as yours? I think it is important that they understand that strong cultural care connection. How do you suggest that they find their way when it comes to that connection?
Definitely. I would say like have cultural humility, practice with respect, empathy, and self-reflection, learn from your patients, build relationships, acknowledge your own assumptions and biases when it comes to patients' beliefs, and be aware of like your limited ability on understanding their worldview and their culture. I think it's also important to listen and build relationships through like respect and openness to know how they're feeling, um, and their worldview on everything. Yeah, definitely just like respect and empathy and kind of checking yourself. Definitely.
Yeah, thanks so much. I'm sure that there, are a lot of new graduates out there who would love to work in some of these rural populations, but feel anxious about that. And I think your suggestions were great. So what do you think has changed for you since you graduated? What changes have you noticed in yourself? It's because it's been what, a year?
Yeah, it's been a little over a year in July. Um, what I've noticed myself is kind of touched on it, but my confidence. Some days are definitely easier than others, which I think it will be forever. We're constantly growing and learning. um, but I think just trusting my gut, trusting what my gut is telling me, and knowing that I know what I know and I know it well. Not second guessing myself. I think that's probably the thing that has changed the most for me. And I'm like, it's so like nice to look back a year ago and feel like I've changed so much in just this short amount of time. Um, yeah, I would say, yeah, just my confidence for sure. There's so much, but my confidence.
Yeah, that makes complete sense to me, because you can't continue to grow unless you are willing to take further risks. And you can't take further risks unless you feel a sense of confidence in where you're at right now. So yeah, so that makes a lot of sense to me. And it's often the one thing that newly graduated nurses do see a change in that first year. They're noticing their decisions are better. Um, like you talked about, you've seen a few things now. And so when you see it again, you're like, I recognize that and I know how to respond to it, or I know how not to respond to
Yeah,
it based on my last experience.
definitely.
But
Yeah.
Darla, that's how we all learn. I mean,
Yes.
that's kind of how we continue to learn. And these seasoned nurses you talked about early on, and you're like, wow, they know so much. there are quickly going to be graduates coming into your area and saying that about you. How does that feel?
Yeah, we have one nurse graduate on the unit, and it's just so funny, not funny, but interesting to see them, because that was me a year ago, kind of thing. And like, I just want to be like, you'll be okay, kind of thing. Like, it's scary, but you'll be okay. And I love like teaching and like being there for someone, and like just like sharing my knowledge, my little knowledge that I have in this 1 year, which is a lot actually, but like sharing that with people who were in my position last year is so like rewarding.
Well, absolutely. It feels really good to think that you've come that far in a year and you're actually sharing those experiences with brand new grads. A lot for a graduate, a lot happens in that first year. So 1 year is like 10.
Feels like
Terms of
it.
a learning curve, Yeah. And so what do you enjoy most about being a nurse now?
um, I like, that's a really good question. I enjoy seeing people like happy with my care, like feeling better, just knowing that like I can provide comfort for someone when they're so like probably having the worst day of their life, kind of thing. And I think that's so rewarding for me, and I just love that part of nursing. And where I'm at right now is so, it's really nice, I think. And I work with like people from all across the ages, so it's so nice to like care for little babies and see them get better, and adults and see them get better, or just care for them in the stage that they're at. And I think that's probably my favorite part, I think.
Well, I'm glad it's your favorite part because as someone who's been on the other side of that care with my parents and myself, I know that that caring, and I can feel it coming out of you, Darla. I would love to have you as my nurse. Just seem so humble and so caring and so passionate about nursing that it's an inspiration. So I want to just thank you for that. I really appreciated that today.
Thank you. You're gonna make me cry.
No, I hope it feels really good.
It does feel really good to hear that from someone. Thank you.
Well, you're most welcome. And is there anything that you'd like to finish off our session by saying to new graduates or educators or managers or anyone who's watching this?
Um, I think thank you for being there for me and supporting me and always sharing your knowledge with me. Or if you weren't my manager or clinical coordinator, thank you for doing that for other new grads in my position. I think it means so much to us and how we move forward in nursing.
Yeah, that's wonderful. Thank you so much, Darla. It was such a pleasure to have this time with you.
Thank you so much.